So this line has to be
Lumbar spine.
Point out to your belly button for me. Right.
It's hard to tell when
Yeah. Don't always use a belly button.
Because everyone
yeah.
Okay. And that one is it 10 by 12?
This is gonna be. She said 10 by 12. Do 10 by 12. 10 wide and then 12 long.
Oh wait, wrong one. So 12 long.
12 long.
It is this one, right? 12 long.
So you're gonna use
Oh wait,
the 40.
wait, it's this one. My bad. And then
Yeah, long.
10.
Oh.
Like that.
Yep.
Okay. Why do I feel like it's not centered though?
You feel like it's not centered? Well, you want to look over here. So she can. Maybe you could shift her a little bit. Is that what you mean? Like,
Yeah.
maybe like the centering point?
Yeah.
Kind of looks centered.
Or is
I
it
think it
just
might be her shirt's off.
So what is this
Okay.
for?
Because it's like right here. This is AP.
AP?
lumbar.
And then
So
she
I
said you put can put the
Yeah.
put it under here, right? Because
You can. I don't.
what do
like
you
doing-
do
I
that
usually
out
do-
in?
I usually just. Well, if they're upright, you could put it behind them before the patient comes, or just stick it on them.
Right there.
Where should you not put it? In the middle?
Yeah,
Clearly.
don't put it right here, obviously.
Right, right.
So, just you want to use the outside. I don't like doing it underneath because you might clip it.
Yeah, I'm
So-
scared of that.
Yeah.
So, and then you have to annotate.
Or like when
eventually.
people put it on the bucky I've
And
seen.
did you line up?
Yes, I did, but then I moved her, so.
And then this is not locked in.
Oh,
So you
I
have
don't
to
know
lock
how to do
this
this
in.
one.
Yeah, so you have to lock. Oh, you guys, and then this one's a button on the side.
Oh
Right
no,
there.
I didn't even know how to do this one.
Yeah, I wish they had y'all practice with this. Yeah. That should be good. And then remember, so how I always do it, once tube, bucky, and then just move the table.
Okay.
So that's just it. Just have a pattern of that, and then you want to use the shielding because for her thighs. Sorry, I didn't mean to. Like, so we could do a small one over here. Possibly. And then don't forget your breathing instructions.
That's on
Is this expiration?
full
Or
expiration.
Expiration, because you want to lift up the diaphragm.
Heavy right
So
here,
take a
right?
breath in.
Breath in.
I would have the patient always say you can put your arms to the side or have them on their chest on
And
top,
then
but I usually have them on the side.
on the
So
side?
or you can
Alright.
do that too.
It was your hands were in the light. Okay.
We're gathered here today to
breathe-
celebrate
Yeah,
the
take a deep
life.
breath in, breathe all the way out, hold, don't breathe, don't move, exposure, I think it's KVP 90, go ahead and breathe,
Okay.
and you move on to the next one.
And so then you do
Is it
the
both? Let's see our technique.
Don't use that one, use the Merrills. The
Yes,
only
and your
reason
body
why
from-
is because it's going to be on your exams.
Yeah, I think 90.
So just, yeah.
It's like,
Do you remember on your exam, for what was your guys'
RPO.
and then this one is where you need to have
So
the
your
light here at
ACEs?
the ACEs, right?
Yeah, so right
So-
after, so you bring her in.
Oh, I feel like I moved the.
So much warmer in here, thank God.
It is.
Thank
They
God,
might have
yeah.
came over here and not over there.
Thank God. It's always cold over there.
Is it her?
Keep those X-ray tubes chilled.
I'm gonna feel here as it is. Whatever. What the hell said that? Was that in
That's
that?
so
That
funny.
video from YouTube.
Oh, okay. So yeah.
What is this
there?
Yeah.
So that's where it is, because you want to have it because it's so oblique.
So
And then you're gonna have her head kind of looking towards that way. What you're trying to make sure.
as that line goes straight down.
Yeah.
Right.
Is this the one where it's to the
Yeah,
ear?
This is the one where you want to
Like
use her ear.
So this way.
It's
I need to
definitely
push
not to her
forward.
ear.
This way.
Right there.
Is her head tilted too much? Because it's not at her ear.
What do you mean?
You said this is the one where it lines up to her ear, or is that a different
Just
position?
her spine's gonna be like right here.
Okay.
So we're good. Right there.
No
But
worries.
you want the arm out of the way, so bring your arm right here. Bring your
No,
arm
you're good.
there.
I can work
There you
around
go.
it.
Breathing instructions still the same. Take a
So
deep breath
breath
in.
and then
Breathe.
deep breath out, and then
Hold.
expose. Hold and expose, right?
Exposure, KVP. I think it's 90.
90.
I don't want to keep saying 90.
The numbers are flipping me out, man.
I know, just to have it, yeah, tonight. So I don't want it to be like, well, how come you guys don't know? 96.
Same thing.
So it's gonna be
LPO? LPO. So don't move the tube. Basically, just move the patient. For
Yeah,
that?
don't
Okay.
move the tube because once that moves, you're gonna
Everything.
potentially cut. And when you see the images,
Gotcha.
you don't want to move the bucky,
And then
move
she
the
said you
table.
Move
just
the
put the
table.
So I would move this down a little, just so it's in
and
the-
then you put this here, like that, or put it still up
I
here.
put it like right about there. Did she have it right here? Yeah, 'cause that's just.
Yeah, because I think she was. Oh yeah, I think she put it there.
Yeah,
Okay.
'cause it's just. There.
And then
Let me feel for me.
I feel like your head's wrong. Like
Like
this.
that, yeah.
So
Sorry, I'm like right there. I feel like you can bring it. Oh no. Bring it there.
Oh, okay.
This is weak. I feel like the pillow just slipped out a little, to be honest. You'll see the Scotty dog.
so like this.
Mm-hmm.
Okay.
And you just want to check.
This is the
straight?
Scotty dog position.
Yes.
Oh, okay.
This is where you'll see Scotty dogs.
Would have passed that test if we took these labs first.
Yeah.
I think it's have a better chance.
You feel like she's crooked? I don't think she's crooked.
No? Okay.
Right there.
All right.
Take a deep breath in. Breathe all the way out. Hold. Don't breathe. Don't move. Exposure 90. Go ahead and breathe.
Okay. And now
So-
we did the lateral, right?
Yeah.
Okay.
You gotta deal with it.
All right. I'm
Yeah,
gonna
what
go
if
ahead
they
and
don't
have you lay on
Do
the
what?
side there for
It's
me.
a toddler, I mean a little girl or something. And what if they don't give you like the
So,
breathing instructions?
If it's a situation like that, we usually, they don't, well, students, you're not allowed to, when they're exposing, to hold the patient.
Yeah.
So, they'll have the parent guardian, whoever's available, we'll obviously give them a lead shield and all that. And you want the parent to help out, cause they know.
Yeah, because I
the
know
kid.
it's a big deal when they, it's great. So I guess
So usually the kid's gonna be freaking crying like hell. So if we had to do a chest, right, I had to do a chest on like a 3-year-old.
15 or 5?
No, this is, what do you, you're
For the
thinking about the
lateral?
spot.
Oh,
It's
okay.
perpendicular,
So
so that stays perpendicular.
this one is either 5 to 8, depending on the.
That, that would be
Okay.
the spot. So
Oh.
let's do the lateral first.
Okay.
So lateral, she's laying down like this, and this works so nicely. Look at all, that was a good patient. So you have that. You can feel for the top of her. And we'll just shift it right there.
Is that the one where she went like this, or no?
I don't like, so that's the spot you're talking about.
Okay.
So finish, and then don't forget the lead strip.
Oh, do we have one?
Yeah,
Did you
there's
say
one
we
over
did?
there.
The parenting skills.
So this is the,
So do we need to open up more on this one, or does it still stay?
it's supposed to stay, and this is just to catch like any of the light or
Oh.
scatter. That's what that is.
So it doesn't need to be close to her.
No.
Just out here.
Yeah, what's the
Okay.
purpose of it? Just
Scatter.
Yeah, scatter,
okay.
and it's just so the image looks better.
Gotcha.
So this one, let's do the lateral first. So you're gonna be at the iliac crest, so it's gonna be right there. I would move it back a little, cause you want to be mid-coronal.
No, but mine has
This is where her body's lined up. Say if she wasn't, you can use that.
Mid-coronal.
I've never had to do that to a patient. I'm mortified to do that.
Oh, was
So
she
to
or
grab, but that's good that Christina taught you guys that. I never did it.
Do
I
what?
didn't know we can
the
do that.
grabbing,
Patients
when
are
you go down
iffy.
About what are you talking about
The
specifically?
grabbing, you know
Yeah,
how
but
she
she's
taught us
good.
how to do
Yeah.
like this?
Like
and
how she
then
has,
over.
yeah, but you see how like
It's
she
too extra.
decided to keep it at a 90, so her shoulders are straight and her hip is straight.
That's an extra one.
on the house.
So you want to be mid coronal, so right about there, at the iliac. There. There's no way you're gonna miss
They're
that.
trying to scam me on my messages.
Oh yeah, that's gone up during the holidays too. I noticed. I
Some
got-
people will open it up. Some people say, "Oh, as long as you see some light in the back." I'm just, like I said, I'm just gonna keep it.
The same?
Yeah.
Okay.
12. Just for your, and then again, same breathing instructions.
So breathe in, breathe out, hold,
And then next, where would you place your marker?
then, I don't even know where my markers are going.
It's not gonna
Oh, you're fired.
I don't know where my right one is.
Oh, so you would use your left one.
Yeah, but I still don't.
Oh, you don't know where your right one
It's
is?
somewhere in here. And you would put it like here, right?
You could place it there
Or
because
put
the
it-
reason is so you can use it for the spot later.
Mm.
I always feel iffy about placing the markers, and I think once you guys actually do exposures, you'll be like, oh, okay, I know where to place it.
Oh.
Not gonna lie to you, it's just like Some people don't, some people do. So the spot. So she has a curvature, right? So I like using the cup method just because it's easier. So you're gonna be right at the iliac and you're gonna cup like that. Then you're gonna move the table to where you wanna be. But first things first, we're gonna have to angle it.
I think she had said
For her, I would do 8.
8. Okay.
Yeah, just depends. Okay, so we move the tube,
Then we moved the.
move the bucky first. So
Oh,
you
you
would,
said how you move this.
just like that. Then I would check for,
And then you do.
yes, so right at the iliac, top of the iliac crest, so just like do that, and then bring it in. Then you wanna be at your knuckle, so it would be right about
Screenshot.
there. Let me check real quick, right there. Is it right there, right there? So you can collimate in too, cause you wanna just get that spot.
So collimate and.
Collimate in.
So
Let me just check what's the collimation. And usually no one is ever specific, that's why I'm like, okay, you know, it's just. So this one's gonna be 6 by 8.
6 by 8.
6 by 8.
Mhm.
Wow.
Damn.
So it's really tight.
Wait, so long and then like that? Or is it the other way?
I think it's the other way. So I would do that.
Oh.
It looks horrible. Right there. I'll just do 7
Damn, Appleton.
right there. And most of them, yeah, you shouldn't be able to cut off.
Okay.
There was the breathing instructions for this, just to make sure.
Is it the she just?
Oh, just suspend breathing. So don't breathe, don't move. Exposure is going to be at 90 or 96. I'm sorry.
Okay. So all of them are 96 on lumbar.
What if they want to burn?
That's. I think for lumbar, the other ones were 90, and then this one was 96. Because I think we have to go through the crest.
Okay.
So there's that. But that would be with Christina, just so you guys are like, okay, well, what do you guys?